All right, guys, welcome to another episode of the Fill Me In Pod, where we dive deeper into the world of aesthetics.
Hi, Jon.
Hi, Nicole.
How are you?
I'm good. How are you? I miss you so much.
I know. It's been way too long.
I know it. When are we going to do an in-person pod? We got to do one soon eventually when our lives aren't in flames.
Exactly.
Right?
When we're not both crazy busy.
Oh my gosh. 'Tis the season. Like holiday season's coming up. Everybody's coming in and getting their beauty treatments. It's just, yes.
We're all over the place. But everybody, welcome back to the Fill Me In Pod.
Yes. Welcome back to this week's episode. Can't wait to talk about what we're going to talk about.
Yes. So today we're really going to focus on client consultation, best practices, building rapport with your patients, managing their expectations. We sent our nurse Grace to a dinner with the amazing aesthetic nurse Melissa recently with Allergan.
Amazing. Wow.
And she said a lot of the questions were kind of, how do you get your clients to agree to a treatment plan? How do you get them to agree to this type of investment? And a lot of the questions were kind of geared towards that. So I think it's a really good topic and a lot of people are talking about it right now. So I thought it'd be good if we touched on it.
I love it.
So let's start with building rapport.
Building rapport with our patients.
Yes. Yeah. How would you say you build rapport with your patients?
I really think that it is all about the patient connectivity.
Absolutely.
I think it's all about energy. I feel like, the minute they walk into the room, I'm giving them a hug. That's just who I am. Some people go, oh, they're going in for a shake, but I'm going in with a hug. That's just, we're going into that next level, but I like to be as personal as possible because honestly, it takes a lot for patients to come through these doors, to come into this treatment room, to get a consultation, for us to have to talk about insecurities on their face, right? So I really like connecting their feelings to the treatment. And because we really are able to see the transformation from the before to the after, and to see them walk out a more confident person. It's just the most amazing thing. So I think truthfully, the minute you meet someone, I think the first 10 seconds are like the most important seconds, right?
Yep.
And once you get through that, make them feel more comfortable, having them look in the mirror, talk about, if they could wave a magic wand over their face, what are areas on their face that they could improve, hearing what their concerns are, but then obviously taking our expertise and saying, okay, put your feelings on me, give me your concerns, and this is what we can do non-surgically.
Yep.
And I think that is really important. I think over the course of the 5 years that I've been practicing, I've really realized it's important to be honest with them. Don't give them over expectations.
Absolutely.
And just be real and say, this is what I can do, whether it is make it 20 to 30% better, make it 40% better. Just give them a realistic timeline. If you're real with them from the get-go, then you're not going to have those issues down the road. And I think where I've had some maybe issues, and I've learned my lesson is, and I have to self-reflect on certain cases, is maybe I wasn't as honest as I should have been in the beginning, right? So yeah, that's my take on it. What about you, Nicole?
Definitely. I love how you bring up the 10-second thing. Like, someone's definitely going to make an impression of you within that first 1 to 10 seconds. And actually in that first 7 seconds, they're going to decide if they trust you or not. So I think definitely opening with that patient connection is so huge. And then once they feel like they have that connection, they're much more open to that active communication with you. If they're not comfortable with you, they're not going to be comfortable sharing what brought them in. They definitely go off of that feeling and that connection, that vibe. A lot of it definitely comes back to those realistic expectations. Like you said too, I think same thing for me in the beginning. It's that you're just not really sure yet on how to sell somebody and how to get them to agree to the treatment. And I think a lot of the time we kind of almost yes them to death. And the longer we do this and the longer we've been in practice, we realize that's the worst thing to do. And you really need to diagnose and educate them every step of the way so that they feel informed.
Yeah. And I think, any provider will feel this. And I don't think every provider's like this. I think it's true of, I don't know, and maybe not every nurse is like this. I don't think there are, but the way that I am personally, I'm a yes person. I've always been growing up. Yes, 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 yes. Never said no. People pleaser. That's who I've been. If you're someone like that, this is where you run into those issues of, and it's like, you have to have those sometimes. You think they're difficult conversations, but they really aren't. It's just telling them the realistic, treatment plans that really,
Right. Yep.
So
And it's having that confidence behind what you're saying too. I think that comes with time as well.
Yeah.
But I feel like, and that's something I try to teach our nurse so much is like, if you understand the aging process and if you understand what you're doing to better that process and better, replace their volume and make sure that we're
Mhm.
rejuvenating what we need to rejuvenate. If you're understanding what you need to be doing, you're just explaining science to the patient. You're
Mhm.
not upselling, you're not even selling anything. You're literally diagnosing and treating.
Mhm.
And once you feel and understand it that way, I feel like it's so much easier to get across to the patient.
Oh, 100%. I couldn't agree more.
And
Mhm.
I think another thing too, as new injectors, body language
Mhm.
is huge too. I
Mhm.
know, oh God, when I think back to when I first started like 8 years ago, I would be so nervous going into the room. So sometimes I would like have my arms crossed or like, you just give off this vibe that's not this like empathetic or open communication. So I think that's a huge thing to keep in mind too.
And I think to add to that, our arms might be crossed because have you ever noticed like we sometimes cross our arms because it makes us feel better because
Yes.
we're
Yep.
anxious.
Hmm.
So, but then if we're anxious and we're doing that, but then it almost looks like we're like
Closed off. Yep.
closed off and
Hmm.
not. So yeah,
Yeah,
I know what
having
you mean by
that
that.
open body language and just make
Yep.
sure you're not closing yourself off to the patient.
Hmm.
And I just feel like a lot of new injectors always ask me that question, like
Hmm.
how do you not get the patient to how do you get the patient to agree to your treatment plan?
Hmm.
And what it comes down to is you treat it like a science. You're
Hmm.
diagnosing. You're not just telling them they need XYZ because you want to do
Hmm.
it. You're diagnosing their aging process, and we kind of
You're
start with
explaining the
the
why.
exactly. Yes. Yep. And starting with
Yeah.
that outer layer, starting with that skin quality,
Yep.
and then kind of going from there. And a lot of patients are like, oh my God, I've never gotten this anywhere else.
I know.
They
And
have
my
that full
thing is too,
education.
lately, Nicole, and I've been doing this now since I opened the practice, I've always incorporated skin with injectables, but now more than
Hmm.
ever, because if you're coming in and you're spending $3,500 on full facial balancing, okay, or even more than that sometimes,
Yep.
depending on how many syringes are needed to give you a good outcome. I always tell them, don't just rely on injectables. You have to lead
Hmm.
with a retinol. You have to lead with a vitamin C. You have to treat your skin. Especially, here's the thing, and it's never too late to start cosmetic injectable treatments, right? Never. But
Hmm.
if you're coming in later in life, you have to understand that it's going to take time and patience to maybe get to the result that you want. And you might never be 100%. It might be 50, 60%
Right.
better, and no one ever really wants to like look like a completely different person anyway. It's true. Like you want to look like you just want to look a little bit younger. And
Right.
most of the time when I'm telling people, listen, it's not going to be an overnight thing, especially if you're just starting in your 50s, 60s, 70s. It's going to take some time and it's going to take a commitment on your
Hmm.
part. But when you leave here, you have to do your skincare. You have to use your vitamin C, your retinol, and just listen to what we're saying. And because that's just going to optimize your results. If you're just going to depend on your injectables over the years and just doing biostimulation, just doing Botox, just doing filler, you're going to look better. But the first thing people are going to see is your skin,
Right.
right? And if your skin is still aging and you're not taking care of your skin, your injectable, it's almost going to be somewhat of a waste of money,
Right. Yep. You
right?
have to make sure that your what do you call it? Skin investment. It's a
Your
skin
skin
investment.
investment.
Yep. You have
Yeah.
to make sure that
Yep.
you're maintaining that and taking care of it.
Hmm.
Absolutely.
Hey guys, just popping in to remind you to like, subscribe, and hit the bell for notifications. Also, don't forget to follow us on Instagram, Injector Jon and Aesthetic Nurse Nicole. Thank you so much for watching. And if you have any questions, leave it in the comment section.
That kind of goes into the next point. So like managing a patient's expectations.
Hmm.
I think what we touched on already is setting those realistic goals and really making sure that you walk the patient through the entire process. I think a great way to do that too is before and afters. I
Hmm.
have these like two very specific before and afters I use all the time because there's some of my older patients in their 60s and it was 11 and 12 syringes on each of them that we did over 2 settings. And when a patient's like, oh my God, I'm doing 5 syringes. Yeah, I like to pull that picture up and be like, look, look,
Hmm.
look at the concerns she had versus what we're going to do on you today. And this is
Hmm.
12 syringes. You're doing 5. Like, you're going to look just like yourself. It's just going to help kind of rebalance and rejuvenize the areas that we need to
Hmm.
treat, revolumize. So
No, it's so true. And you know what I love using is the Juvederm. It's like it shows what 1 syringe of filler is, 2 syringes,
yes,
3. You know what I'm saying? And
yes,
how like
yep,
the 1 syringe size of a blueberry, and then, and when people see that, especially because I offer, especially for lip filler, I offer
hmm
either a mini pouch or a full pouch. A mini pouch is a half syringe. Anything more than a half syringe is a full pouch, right?
Mm-hmm.
So it's just really nice to kind of tell them, especially if they've never had filler before, or like they got a half syringe and then they're wondering why once the swelling goes down, it doesn't really look like much. It's because you only got a half syringe. It's very, very little. And the reason why I made a mini pouch is really for lip maintenance. You know what I mean? And then there are some patients that have such thin lips or like maybe smaller mouths that a half syringe does kind of look like a full pouch, right?
Yep.
Just because they don't have enough or what am I trying to say?
Like their anatomy. Yeah. Their anatomy just doesn't call for it. Yeah, exactly. Yep.
Right. So that I always show that, especially with doing full facial balancing. I'm sure you do the same thing, just showing them that. They're like, oh, okay. So one blueberry here, one blueberry here, one here, one here. They're like, okay, it sounds like a lot, but realistically it's not. And you, I'm sure know, like, I feel like when I started 5 years ago, it was around the time where like people were using one syringe of filler and they're doing 0.1, 0.1, 0.1, 0.1, 0.1. And I get it. Cost, I get it.
Yeah.
Like, you know, things are expensive, but it really, oh my God, I just remember how challenging it was, especially opening up my practice almost 3 years ago and having those difficult conversations. And they can be, and kind of getting them out of that mindset.
Right.
But once I did, it was great. And now I feel like I'm fine. It was just, there was just a time frame. Did you feel that too?
Yes, absolutely. And I always try to explain that to new injectors too. Like if your patient is on a budget, then we should focus on what the major concern is for the patient. If they can only afford one syringe and they came in with these really deep laugh lines and we decide to take one voluma and try to lift with the cheeks, your patient's not going to be happy. And I feel like we see that all the time on Instagram. Like, don't treat the laugh lines. Don't treat the laugh lines. Like if your patient is coming in, they have severe laugh lines, you need to do some filler there.
You do.
And one syringe is not going to harm anyone. Yes. Thank you.
You can. And we're not going to ever overfill them.
Right.
But you can.
Right. And that's the way, if you were to try to take one voluma and split it half and half and your patient left, they're not coming back because they are not going to see a change. You know, if they genuinely have a budget and you only have one, I would take a filler that's going to give you as much as it can and put it through here. When they see that change, they're going to be like, oh, okay. And then they're going to want to do more and they're going to want to continue to balance and harmonize and
true, Nicole.
Treat from there. You know, that's one of those things where it just comes with time. And the more you consult and the more you treat, you're going to understand. But I always try when I get that question to kind of get that across to my trainees, like treat what they're, you know, to the best of your ability. Now, sometimes you can't, again, back to you can't always be a yes man, you know, you do have to say no and certain circumstances.
Think that your personality truly matters. If you're coming across too selly, if you're coming across a certain way, whether your energy is too strong, right? I mean, these are vulnerable situations. You have to kind of be soft, right? And an empath. If you're an empath and you're deep down like just a humble, good person, it's going to go further.
Absolutely.
And I like being in the room with patients, it's just such a vulnerable time for some of them. And just sitting at eye level with them and being, and you want them to see your passion, you know? And if you're truly if you're passionate about your craft, you're going to go far, no matter what profession you're in, you know?
Patients will see it. Absolutely.
They will.
And they'll feel it.
And I really think that will determine whether or not they go through with the treatment.
Absolutely.
Is that they feel if you're passionate or not.
Yeah, absolutely. Yeah. So I think a big part of managing expectations too is like customizing the treatments, which obviously we do for every patient. You know, I like to utilize the iPads and the TV screens and really pull their pictures up and kind of show them their aging process and on their own face what's happening, but also giving them like a write out or a type up of everything that we talked about. So even if they don't feel comfortable moving forward that day, they go home with something tangible and they can look at it and be like, you know what, I am going to do this, or I want to start with this and kind of go from there. I think with treatment plans too is good because I'm sure you get it a lot too. We all do, like the budget. So I think having treatment plans is good because we can come up with, maybe they need 7 syringes, but we could split that into 3 different visits, you know, over time.
It's so true. It's true. And everyone is not a cookie cutter treatment. You know what I mean? Everyone's different. It's impossible. Like what your sister got, you're not going to get.
Right. Yep. Oh God, my sister, I did 2 Volux and 1 Voluma in her chin.
Ooh.
Like 3 days. Oh, it looks incredible. My sister, it's so funny. I'm a twin for anyone that doesn't know, and we're fraternal, and she has no chin.
But they both have a fear of needles, I believe, right,
Yes,
Nicole?
yeah, yeah.
Yeah, I
But
both have seen you freak out.
my sister is much worse than me.
Oh my God.
But yeah, no, she like I did 3 syringes in her chin, but if you did 3 syringes in my chin, I would look insane. Like,
Oh my God. Hello, Jay Leno.
yeah, exactly.
right.
Like we don't need that. But that's why assessment and, you know, making sure that you're respecting each patient's individual anatomy is so huge. And I feel like you really do have to have an eye for that.
You do.
Yeah.
You do. Do you ever feel with chins, Nicole, like and this is, I mean, ever since I've started, there's some chins I can do needle to bone, needle to periosteum, 2 syringes. I can do that. But the chin is a very small area. And I feel like just because of soft tissue swelling too, right? And the tissue's expanding. Sometimes if they have a really recessed chin, it's hard sometimes to do a full 2. Like it almost gets too tight.
Yep.
And like I have to have them come back and do multiple sessions.
Absolutely. Yep.
Right.
Yeah. And I actually, Cannula King, I learned from him when we were in California that you don't want to be doing too heavy of boluses on the chin because they're actually seeing some bone resorption there. With big boluses right on the bone. Okay. So he suggested like no more than 0.2, which I don't ever do anyway. I always do less than that because it keeps us safer in all different areas. But that's why I will typically start right in the center and do a few, and then I'll switch to cannula.
Yeah. And you can kind of come down and
exactly. Yep. And just create a nice like point to the chin. But yeah, that was something he taught me recently in California. And that's why we keep going to conferences, because you always learn something.
I know. And using cannula, if I'm correct, in this, especially in that subcutaneous tissue, with filler, it lasts longer.
Yes, absolutely. Is that right? Yep. Okay. On top of customizing the plans and all of that, we have to also really emphasize patience to our patients.
Patience to our patients. Okay.
This is not something, Rome was not built in a day.
Sure.
For some people it is. Like, you know, I did my sister's chin with 3 syringes. She got an immediate result. It's great. For our older patients with a little bit more aging or laxity in the skin, it's going to be more of a journey for them. We have to work on the skin quality. They need to be doing skincare, maybe even lasers. Then we can add in the volume, and it's going to take much more time for people like that than you're just, you know, quick lip plump or things of that nature.
And I know. And like, are they coming with severe sun damage? And there's just so many vertical wrinkles all through the cheeks and just the forehead. And they're so deep, you know, and like, obviously one Botox treatment, they're going to look a little better, but those deep lines are still going to be there. And that's why you have to talk about a retinol, like you said, and then a laser treatment, some microneedling. And like you said, like Rome isn't built in a day. It's going to take time and patience to notice a difference. But talking about from the get-go, realistic expectations and saying, listen, it's going to take time. And if you're okay with looking like 30-40% better, maybe in 2 years, if you do XYZ, this is how I can help you. Right. And you have to be okay with spending what you're going to spend. And even those patients that have deep setting lines in their skin from from sun damage, from side sleeping, from whatever they're doing, you know, even a facelift is not going to take them completely away, right? I mean, it's just, that's the nip and tuck. It'll help with skin laxity. They're still going to need resurfacing lasers, collagen production, biostimulation, which is like Sculptra for those of you that didn't know. But yeah, right, Nicole? No, like definitely. And I feel like patients think like, oh, I'm just going to save up for the facelift. Like that's great and all. And facelifts are always going to be a little bit more of a drastic result than your fillers and things like that, obviously. But you still aren't addressing the skin quality. And even after the facelift, I can guarantee you're still going to want Botox. You're still going to want minor changes here and there. So always keep that in mind too. And a lot of plastic surgeons, while you're under getting your facelift, will actually do a skin resurfacing laser for you, which is great. Perfect time. Yeah. That way you're not present for it. You wake up and we're done.
Yeah,
you know?
Exactly. You just got to heal.
Yep. You just have to heal. And I can't stress enough about how many patients who I refer for facelifts. And I tell them, you know, you're going to go get it done. You're going to look great. Your jowling is going to look better. You're going to look more youthful. Your neck's going to look better. However, you're going to come back and you're still going to need filler. Right. And sometimes they're like, really? And I said, no, yes, because it's a nip and tuck. Yeah. It's not replacing volume. Exactly. Unless you get like a fat transfer or something. Right. But you still are going to need volume that's been lost over time, because we lose about 5 syringes of filler a decade, right? Which is, what is that, a tablespoon?
Tablespoon. Yes. It's
Yeah,
a
tablespoon,
packet,
right?
ketchup, right? Ketchup packet.
Yeah. So you lose about 5 syringes of filler
Yeah,
a decade,
yeah.
starting like age 30ish, like around there. So if you haven't had anything done and, you're listening and you're in your 50s or 60s, you've lost about, 10, 15 syringes of filler technically, whether it's deep fat pads or superficial fat pads, right?
Right.
And that's why it's very important to go to someone who knows, obviously, the depth of their injections, where you're losing that fat loss or the volume loss, and where to inject it. So that way you're going to be yielding a good natural outcome.
Yes, exactly. That's a good thing to touch on too, because if you're in the wrong plane, especially in the cheek, that's how we can make people look very chipmunky and too full.
Correct.
So
Yeah.
again, that's something that comes with experience and time.
And that's why we have our patients smile, right? You're smiling. We're seeing like where you're fuller. If you're already smiling and full in the apple, we want to kind of avoid there and maybe do more lateral upper, temple. Temple is not talked about enough. When we finally got the FDA indication now for temple, which me and Nicole, we're going to be training other injectors on temple with Allergan, which we're very excited about.
Yep. And that's something we train on all the time, is the art of consultation. So always having the patients animate before and throughout treatment, and then rotating and tilting. So you're just looking at the face from all different angles, all different expressions, because no one's walking around stone cold, same face all day long. We're making expressions, the skin's going to move. It's going to fold in certain ways. So especially when you're treating the laugh lines and stuff, I always have the patients animate, make sure you're never giving too much fullness, things of that nature.
Couldn't agree more.
Another question I get all the time from new injectors is like discussing the possible side effects.
Okay.
So I do understand how it is a hard topic to bring up to patients, especially with some of the scarier potential adverse events. But Dr. Yolen said something once that stuck with me. He was like, it's only a complication if you didn't tell the patient it was a possibility beforehand. Because it's so true. Like if they understand that this is something that unfortunately can potentially happen, when it happens, they're not going to be as alarmed or, like it's still alarming, but they were aware that this was a potential. Yep. So I always review, we have a video that plays and I review and my assistant reviews all the potential complications, the major ones, obviously like infection and things like that we go over too. But I always want my patients to understand that although it's extremely rare, there is potential for tissue death. There is potential for blindness, recently stroke and PE. Again, these are extremely, extremely rare. And we see it more with people that are unlicensed and things of that nature. But I want my patients, because if I were getting this done, I would want to know. So I like my patients to be very informed. And the more you do this discussion with every patient, the easier it will get. But I do think it's extremely important to do.
Well, and that's why we do as much education as we do, right? Going to these conferences, Nicole, you and I are going to the Mauricio de Mayo MD Codes this year in November 16th,
so
which
excited.
is out in LA, which is really exciting. It's a quick day of training, but it's incredible. That's another cadaver lab. Oh my God, Nicole, we've done 3 cadavers this year.
Yes.
I crack up because I went into 2024 going, I'm going to do my first, I did gross anatomy, right? I did that, but when I was in MP school, but I'm like, okay, I'm going to do my first facial cadaver. Like, I'm so excited. Well, now 3
finishing 2024 with 3 of them.
I think I'm good. No, I'm kidding. No, I think we should do at least 1 a year.
Yes,
of course.
Agreed. Yeah.
And now I know why. I know why, especially as we're getting more indications for different areas on the faces with, varying, risks to those areas. But that's why we do all the education that we do is to make sure that if there is a complication, we know how to manage it.
Of course.
And if you're an injector and you're listening to this and you have your own practice, please invest in Hylenex. Have it in your office. You think that it's not going to happen to you, no matter what your skill level. A complication can happen to anyone. Yep. And of course, if you're more educated, if you're more knowledgeable of these things, they can happen a little bit less, but they can still happen to you because you're human, right? But invest in Hylenex. I can't stress that enough to have it and what I loved about this year's, for those of you that are listening that are Allergan trainers who went to the trainer for Temple, they really dived deeper into the complication management.
Yes, that was huge.
And Nicole, I mean, you sent me when you first opened your whole crash cart and everything in there, and I was like,
yeah.
like on there ordering everything, for it, which I have it in the back. But it was so helpful at that train the trainer to also just reiterate the importance of complication management and what we can have at our practice to manage those things. And also like to make friends in the community that are ophthalmologists, retinologists, other, things like that.
Absolutely. Yeah, absolutely. Because I feel like it was a topic that was kind of always skated around. We would talk about the treatment and the filler used for the treatment, but we never talked about, God forbid something happened. What do you do? It was always, Hylenex, but it was never in detail. So the fact that we are able to get so much more in detail now is just so exciting. And if you carry Allergan products, there's going to be protocols and things that you're able to get from your BDMs and stuff too. But it's incredible. And I think when you go over these possible side effects with your patients, if you have a genuine understanding of how to treat these complications, you're not going to be worried about going over it with them, because you're going to say, listen, I have a referral for a hyperbaric chamber. I have a referral for an ophthalmologist, God forbid, and I have all the Hylenex in the world. I know my neighbor down the street who has a med spa, and, God forbid we ever need anything, we exchange. So definitely important.
Yeah. And I can't stress enough. I feel like there was a time that people were going on social media and saying, this was not my patient, but it came from another practice. And this is the complication. And I fixed it. I fixed it. And I'm the hero. And listen, great. You are the hero. Thank God for you that they found you and that they did that. However, that could have happened. That complication could have happened from someone who was a very competent person, who was good and educated. And maybe that complication happened by someone who didn't have that connectivity to a patient, that didn't make that patient comfortable enough to approach them with it. And maybe that is the problem. Right. But I just don't like how, people were doing that on social media and broadcasting it like that, because it just gives a negative connotation to that stuff. Because in real aspect, I mean, it can happen to anybody. Right?
And it is a little fear mongering towards our patients. So it's something, that,
like, I think, is it important, I think, to like highlight some of those?
Definitely.
I think it 100% is. I just don't,
there's a way to do it.
And I just don't like it when you're saying, oh, this was not my work. And like this, like that. Just say, I was approached by this. This is what happened. This is how we did it.
And that's something that, with our nurse that we hired here too, I always say, if a patient calls with a potential complication, even if it's the most ridiculous thing you've ever heard, like, some people will call and want to know if their stomach bug is related to the fact that they got Botox last week. Like you get so many funny calls like that, but I always say, like, always,
but it happens.
Right. And always imagine that you're the issue, so that you can fully make sure that you fully assess and make sure that you're not the issue. Because if you also don't want to just brush them off and it turn into something that you didn't address.
100%.
So I always say, let's chat. I want to know all your symptoms. Let me know what you're going through, because I've heard crazier things,
Well, there's even times, Nicole, like, and these are like, a patient of mine of literally 5 years. It was a couple months ago. I did her Botox and I had never bruised her. LOL. I mean, I was like, wow. Okay. But this time she had like a little bit of and she literally reached out to my front and she asked, like, is this normal? Blah, blah, blah. And I'm like, oh my God, did I not educate enough? I always self-reflect and I go based on me. And I'm like, I should have made her aware that it is still normal to bruise. But because she had no bruising ever before, I mean, we're putting needles in your face. Of course, you could have injection site swelling. You can have a little bit of bruising and, God, we've all had it. I've had a black eye from filler,
same.
But like you said, education is so important. And no matter how long that patient has been a part of you, like at your practice, you still need to make sure that they're educated and that you're being a good provider for them and they feel comfortable coming to you if there's ever an issue.
Exactly. I have a very similar story. I had an older woman who I've been doing her Botox for years and around the crow's feet. And I could tell when I did it, she had like a little pinpoint bruise and I'm like, oh, that's going to be nothing. Like, you have a small pinpoint bruise. Like, don't worry about it. And oh my God, she called the next day. She had a black eye. I mean, it was crazy. And, I called her right back. I'm like, again, I apologize, but also, like, it's unfortunately there's nothing we can do. There's all these little vessels in the face. Like, it's not something that I did differently. It's just that this time on the way out or on the way in, we nicked something. And, but she was so understanding, and I checked on her for like a couple of days and she was so appreciative of the fact that I called her. I feel like a lot of us too, especially if you're newer, are like, oh, I talked to her already. I'm not going to call her again. Like, the follow-up is something that the patients appreciate so much, the hand holding. And I know it can be a little frustrating sometimes, but it's something that they're like, oh my gosh, they checked on me. You know, they're making sure that I'm healing good, you know, and a bruise is a bruise. It won't last longer than 14 days, hopefully. You know, unfortunately, the eyes take a while to heal. But there's, you know, I told her warm compress, gentle massage, and it cleared up pretty quickly. But it's just something that, if you're not there, because you're right, they'll go somewhere else and be like, look what happened to me. How many times do we hear that? A patient comes in, I got Botox for the first time, they bruised me like crazy. And then they show you the picture and you're like, oh.
I know.
That's not bad.
And I have my my front desk call all of our patients 2 weeks after their Botox treatment. How are you doing? Like, girl, boy, how you doing? Like, how's it going? Do you need a follow-up? Do you need Jon to take a look at it? Are you happy with it? You know, and occasionally, I'll see a follow-up in my schedule and it's great. Maybe they have a little, you know, like a spot fix that I need to do, or a little, you know, they're having too much movement in one area and I have to touch it up. It's good. Our patients are products of ourselves out in the public eye, and it's our work. And I want to make sure that everyone is raving about us, right?
Absolutely.
And that we're doing a good job. And like you said, the follow-up is so important with our patients. And if they're feeling heard, that's the most important thing.
Yep. And there's actually proof behind that. If you call and follow up at that 2 week mark, you have better retention with your patients than if you don't. So it's just so important to follow up with them.
Full face rejuvenation. I feel like it's very important just to follow up with them as well, just to make sure, hey, how you doing? Maybe like 3-4 days later, you know, how's everything settling? Any questions you have, you know, because sometimes you're like thinking, okay, they didn't call, things must be okay. But some people don't like to call and bother you.
Right.
If there is a complication or if there is an issue, they like feel like embarrassment, which is, you know, of course, oh my God, we never want to make someone feel embarrassed.
No, ever.
So the fact that you're just taking that responsibility out of their hands, it means the world to them.
That's so true. So true. Yeah. And we always have an emergency line. And I tell people, like, I would rather you call me on a Saturday morning or Sunday night than you sit on something that could be potentially not good. You know, I want to know about
says the same thing. My husband, Dr. Stewart, who does our weight loss program here, he literally says to all of his patients, call, text me. I don't care when. We have the phone home with us. Like, we want to know if you need anything. I don't care what it is.
Yeah, it could be any question, but I'd rather you reach out to me than wait 3 days. And then you get, you know, God forbid it is something wrong and you waited 3 days till Monday morning. And then I'm like, oh my God, we needed to deal with this, you know, right then and there. So but we got a little sidetracked back to our we're just like, there's so many
consultations.
Yeah. It's all the same. It's all the same.
Yeah. It all blends.
Yeah. But definitely I want to talk about like how we close the consultation. I feel like I get a lot of questions regarding, like, you know, basically newer injectors that are like, I can only close the consult on like lips or one syringe, or, you know, how do we get to that point where you're really closing the consult, you're getting them to come back and you're retaining them as a patient? So I think one of the major things that we talked about is answering all their questions and really making sure that they leave with a treatment plan and something tangible that they can refer back to. I think what a lot of places don't do that you and I definitely do is giving that detailed treatment plan. Also, if you're just in there talking, you know, when patients come in, they're nervous. Half the stuff we're saying is going right over their head. So when you write it down for them, it makes all the difference, because they may have been 2 to 3 places before you for a consult, but they didn't leave with anything tangible. So I think that's a huge portion of it. And also the education. Yeah.
I actually advise all of my employees here that are providers, our esthetician, our RN, and then myself. I actually follow the patient up to the front desk. And I, you know, let my receptionist know, okay, book their next Botox 3 months out, schedule their IPL for 2 weeks out from now, and let's book a mini full facial rejuvenation in 4 weeks or something. And I kind of give her that timeline, so that way I'm not just like giving them something in the room, I'm leaving, and then they're going up front, and then, you know, my front desk is like, all right, so what are we booking? And they're like,
and she's like, I don't know.
I don't know. It's on here. Like, but like, it's so much easier to come up
Absolutely.
And I'm visualizing, okay, she's making this appointment. Then I'm like, all right, we're good. Then I leave.
Yep.
And it makes the patient like, oh, great. Like I didn't have to worry about telling
Exactly.
her.
Yep.
I also like, my lobby is a little bit smaller. So I just want to make sure that
Yep.
other people aren't listening in
Yeah.
on what,
we're not stressing anybody out.
Right.
Yeah.
Right. So yeah.
Yeah, no, definitely. I think that when you walk them through it, I think it's just something especially that they don't experience elsewhere.
Yes.
It makes you stand out for sure. For sure. And then building that empathetic, like open communication, building that rapport with them is just so huge. If they don't, like you said earlier, if they don't feel the passion, they're not going to choose you.
I know.
So I think really creating that relationship with them, making sure that they feel comfortable, you've answered all their questions. And you can only do that when you're educating yourself too. And that's why Jon and I are so big on continuing education, making sure we attend a few conferences a year, doing cadavers, because the more that you're educated and even networking, like we just did a podcast with one of Jon's friends, a cosmetic dentist. And, we even learned so much from stuff like that. Like, we learned so much about TMJ and
so eye-opening. And you think we know like enough about it because we do so much master Botox, right?
Right,
but like,
right.
It was like obstructive sleep apnea,
right?
And like ADHD, Adderall. Like
I'm like, I got to change my whole intake form now.
Holy moly! We don't want to elaborate too much on what we talked about in that, but that'll be on I think next time.
The next episode.
2 weeks.
Yeah. But I mean, it's just it's so important to continue bettering your own education so that you can constantly be changing your practice, making it better, and supporting your patients better. And they see that, they watch that, they see that, they know.
They do. And Nicole, I think it's patients like a visual too, and I know that you do this too. I've seen you do it like on your reels and all that stuff. But giving them the mirror and like kind of walking them through, like I'll have like a white marker, like or a white crayon, whatever, and then I'll show them where I'm seeing certain asymmetries or like a volume loss. There's a lot of people actually that because of a bite issue, speaking of like cosmetic dentistry, their one side is wider than the other side. Have you've seen that, Nicole?
Yes,
like just because I think they're able to touch their teeth on one side, but not their other side.
Yes.
And then they're wondering why they feel like a misbalance, and it's they're more squared off on one side, but not as much on the other. So doing like, normally I do 20 to 30 units per side for the masters. So like maybe doing 25 and then 15 on the other side.
Exactly.
You know what I mean? So, and that's why like every, and some people also wonder, they're like, so if you did like 2 syringes on this side, so I'm going to need 2 over here.
Right.
Not necessarily, right? Because we're all asymmetry. If I just did the same thing on both sides, it's going to look the same. We want to make them look as closely alike as possible, right? But back to the point that I was talking about, because I'm going on a tangent. I'm so sorry. My ADD.
Typical us.
And this espresso's kicking in. Sorry. But basically giving them the mirror, and I'm basically drawing on their face, like this is where I want to do 1 syringe in the chin. Then I go up and I say, highlight, okay, this master is bigger. I think we should do a little master Botox here to slim this area a little bit more. And then it would make your cheeks pop a little bit more. And then maybe we'll add a little bit of filler to this part of your cheek. This temple's a little bit more hollow than this temple, or, like you're basically kind of making a visual. So that way they're like, okay, if we do all of this, this is what I'm going to look like.
Exactly.
Or you're telling them the science behind the injection, the why behind the injection.
Yeah. And I think that is the biggest part, is that why behind what we're doing. If they understand why you're doing it, there's going to be no question there.
100%.
Yep. I think another question that I get a lot from newer injectors, honestly, even injectors with experience, is budget. Like, how do you help the patient stay within budget? Or if it's way above their budget, how do you help them still reach that goal? I think a huge thing, obviously we've always had financing like Cherry and things like that, but Alipay has been like huge in that. They can use their Ali app and get approved right then and there. It's a soft credit check, so it doesn't affect their credit, and they can pay monthly. So I think
is it even a credit check?
Yeah, it doesn't do anything to their,
which is amazing.
So it doesn't affect their credit.
We have more patients not using Care Credit and just using Cherry because they're having more payment options and lower interest rates. And like you said, it's like it's hit to your credit.
Easy, and it's quick, easy approval.
My God, 2 minutes to apply. Like if that, I know, it's amazing.
Even if patients weren't planning on using it, once we tell them about it, they're like, oh, sign me up. So I think financing options are huge, but I also think the treatment plan, when it comes down to it, if a patient's like, listen, I really can't do this chunk. If we talked about full face, maybe we start in the mid face, and then work our way down to the lower face and finish with the lips, or, something of that nature, to kind of break it up and make it a little bit easier for them to.
Cost, I want to address your question about cost. And I get that, the economy is tough right now too. And just in general, this is a lot of money. People are coming in and they're paying, and it's their face. The thing is that, I don't want to cheapen like what we do. And, if I'm telling you that we're going to get to this outcome eventually, whether it's in 1 or 2 or 3 sessions over time, I get that it's going to be expensive. I get that that's your money, but my thing is instilling that trust in the patient, that they're making that right choice. And I never overpromise, but it's just setting that back to, we're sounding repetitive, but the realistic expectations with them.
Yes, yep.
And that I think it's all about the connectivity with them, the realistic expectations, and connecting that feeling or emotion to that treatment.
Yes.
And that hopefully gets them there. And we never give a treatment to someone they don't need.
Yes.
Right.
Yes.
And first off, we don't need any of these things to survive. Right. But we're never going to overfill an area, overdo something that they don't need.
Yes.
How many times, Nicole, do you say no?
Oh my God. Several a day. Yeah.
And patients appreciate that.
Yeah.
And they go, wow, he said no. Or like, oh, I came in for my lips today. That was going to be $700. And he said, no, I didn't need it. And I'm,
I get thanked all the time for my honesty, because they'll be like, well, I wanted to do my under eye. I'd be like, what under eye?
You're right.
You have no under eye.
Oh my God.
But, the wrong place would be like, okay, let's do it. So I do. Patients thank me all the time for my honesty.
Yeah, you have to be.
Yep. It's huge. And that goes back to that rapport that you build with them. You know, they got to trust you.
I agree, Nicole.
Yeah.
So guys, thank you so much for tuning into this week's episode of the Fill Me In podcast, where we talked about the art of consultation. And I hope you guys learned a little bit about this. We absolutely are so passionate about this topic, Nicole and I.
Yes.
It's honestly my favorite part of the day with my patients. I mean, obviously, like the routine maintenance Botox follow-ups or appointments and all of that is great. But when I see a patient consultation in my schedule, I actually get like so excited.
Right.
And I usually leave the room like on a high, because I'm so excited about either whether it's a full facial rejuvenation or even if it's just Botox. Like, it's just the fact that someone's in that chair and they're wanting to be with you. It's just, it's the best.
Oh, I totally agree.
Yes. But thank you so much, guys, for tuning in to this week's episode of the Fill Me In podcast. I'm Injector Jon.
And I'm aesthetic nurse Nicole.
We will see you next time.
Yes. Thank you, guys. Have a good one.